Hey everyone.
Hello, hello, hello.
So today we're going to talk a little bit about acne. Acne is one of the most common things that we see in a kind of outpatient medical dermatology office. We see kind of all ages, both sexes, and all different types of acne. There's kind of categories of different types of acne. There's comedonal acne, which are basically the little bumps under the skin that often aren't inflamed. Blackheads can be a type of comedone. Little white bumps under the skin also can be a type of comedone called milia. Then there's inflammatory acne, which are the inflamed red bumps, and there can be little pustules with those too. And then there's kind of deeper, more cystic acne. It can be hormonal or just kind of larger, deeper, more inflamed nodules. There's a couple other forms of acne that are more severe that can involve kind of extensive scarring also.
Yeah. I mean, and when we think traditionally of acne as a disease of teenagers, and in fact, the majority of our cases are of teenagers, but what we're seeing a lot more of is what we call adult female or hormonal acne. So all those categories that Dr. Naga mentioned can be found in teenagers, but hormonal or adult female acne usually occurs in their 20s and can go into the 30s, and we have a few patients into our early 40s. What makes adult female or hormonal acne different? Well, number one, it's the location and type of lesion. So they tend to get it in the lower face jawline area, though it can be in other areas, sometimes on their chest and back. It can be more of those papillopustule nodules that are more cyclical in nature. They're not like all the time there. So you'll see some kind of flares, and it can coincide with your menstrual cycle, but it's not always the case. But the cyclical nature of adult female acne is kind of classic. And this is something that we see increasingly more frequently in our clinical practice. Yeah.
And people can have different types of acne also. You can have comedonal acne as well as inflammatory or cystic hormonal acne as well. And the reason it matters, making that distinction matters, is because we treat each type of acne a little differently with different products, be they topical or oral. But it's just important to make the distinction so we know the best approach to treat your acne with. There are many things that can contribute to acne. Very first step of acne formation is kind of the clogged pore. Skin cells that are sticky. Some people have stickier skin cells than others. They can kind of clog a pore, and then that can result in inflammation. Bacteria on the skin plays a role. A person's kind of inflammatory environment in their body can contribute to acne. Hormones can contribute to acne. Oil on the skin contribute to acne. Products that people are using, if they're not using oil-free or non-comedogenic products, those can contribute to acne also. Diet has also been very weakly linked to worsening acne. I don't really think diet is often the cause of acne, but it can worsen acne, specifically dairy or sugar. So there are many reasons, and I think in each person there are different things that are contributing more than others, but all of the things that I just mentioned can often be a part of.
The way I like to explain to my patients, there's an inherent susceptibility in certain individuals. That's what we call polygenetic. It's not like, oh, my mom had acne, I'm going to get acne, but there's an inherent susceptibility to it. Everyone wants to pin acne on just external causes, and that's not really the case. There are external things that can make acne worse in someone who's already genetically kind of predisposed to it. So we talked about diet. Loose data on high glycemic, kind of bad diet. So if you eat poorly, your existing acne may get worse. If you're putting a lot of heavy, thick products on, some people can tolerate it well, but some people are genetically, can get those comedones, those clogged pores. So I always like to say, I don't want all my patients to go crazy and go through their whole routine and try to figure out that one cause that something they're doing is wrong. I like to say sometimes you can blame your parents on that susceptibility, but then there's good products that we can do to kind of fight and to prevent those acne from developing.